Hello, my name's Martine Ellerbeck and I'm a midwife and I work here for the NHS at Barnet Hospital. So being a midwife is an absolutely fantastic career. So you look after women from the moment they're pregnant, all the way through the pregnancy, through the labour and in the period after the delivery of the baby. It's a fantastic role, you're very, very privileged. You get to be with people which is in the most important day of their life and they will remember you for the rest of their lives. So the job that I do at the hospital, my job is the clinical practice facilitator. So I look after all the student midwives here at the hospital. So if you were to be a student midwife and based at Barnet, you'd get to see me every day. And what my job entails is organising placements for all the students, making sure that you have a rota and making sure that you've got plenty of support while you're here. There's also lots of teaching involved as well. So there's many other roles within midwifery. So some of those would be a community midwife who would have a caseload of women, and they again would look after women from the moment they're pregnant, all the way through the birth and in the period afterwards. You could be a delivery suite midwife where you care for women when they come into the delivery suite to deliver their babies. You could be a midwife on the ward where you have a caseload of 8 women, maybe antenatally, who need an induction of labour or there may be some complications. Or you could have a caseload of 8 women and 8 babies that you care for. So you'd be making sure that the women have all the support with infant feeding and caring for their baby. So other roles that there are in midwifery, so you could be a risk midwife, so looking into incidents that may happen in maternity. You could be a screening midwife, so women have screening for different diseases, so you could get involved in that. You could be a fetal medicine midwife, so if there was any problems in the pregnancy with the baby, you'd be involved in that. You could be a practice development midwife, and that involves making sure that all the midwives and obstetricians are up to date in all their training. There's lots and lots of different roles within midwifery. So if you wanted to become a student midwife, the things that you need to do is you need to have a grade 4 GCSE in English, Maths and Science. After that, you would need some A-levels, so you'd need 2 Bs and a C, and you'd need a B in a science or behavioural science. You could also get onto the course via a BTEC. So to be a student midwife, you apply to university. The 2 universities that are local to us are Middlesex University and Hertfordshire University, and those are the universities that I work with within my role. But again, there's lots of universities throughout the country where you can study midwifery. So a day in the life of a student midwife, well, your time is split between university and clinical practice. So you could have a block of 8 weeks in university where you're getting all your theory, and then you could come out into clinical practice for an 8-week block. So within that day of the community midwife, you could be assigned to the community. So you'd arrange to meet your community midwife. You'd go and do some clinics, perhaps in a GP surgery, and then you'd go and visit women postnatally when they've been discharged from hospital. So if you're on the delivery suite, so you'd come into your shift, you'd know exactly who you were working with beforehand, and you'd get a handover from the woman you're looking after, and then you could be there caring for a woman in labour and delivering their baby. If you're on the postnatal ward, you'd come in, you'd get a handover, so you'd know all the information about your patients, and again you'd be providing either antenatal or postnatal care for all those women and babies. So you could also be assigned to the antenatal clinic, where you'll be providing antenatal care to women. It's very exciting, but you could also be here actually on the birth centre. So here we are in the birth centre, and this is a birth pool, and you could be assisting women delivering their babies in the birthing pool. So it's a really exciting job and course to be involved in. So currently the government are offering you a £5,000 grant to study midwifery, but the university's fees do apply as they do for all university courses. So the thing about midwifery in this course is that it's when you are here that you're doing shift work, so you'd be assigned a practice supervisor to work with and you follow their shifts. So the shifts are long days, so they start at 7:45 in the morning and they finish at 8:15 in the evening, and a night shift starts at 7:45 in the evening and finishes at 8:15 in the morning. So you would be expected to do long days, nights and weekends because you follow the shifts of your practice supervisor. but it is a really, really exciting opportunity. And the best thing about it is that we can guarantee you a job at the end of this. So currently here at Barnet Hospital, we employ all our student midwives because we know that we've given them the best training possible. And we recognise that, and we value you, so we really, really want you to be part of our team. So what skills do you need to be a student midwife? Well, you need to be calm, you need to be able to communicate well, and you need to be really, really keen to learn. And if you've got those skills, with the education you get and the support you get in practice, I'm sure you can be really, really successful. And I look forward to meeting you in the future. Goodbye.